I'm Dr. Julie Latta. I'm the Emergency Medicine Residency Program Director at McLaren Macomb. I've been the program director for quite some time now, but it wasn't too long ago that I was in your shoes, and I was looking for the residency program that would be the best fit for me. Ultimately, the best fit for me ended up being right here at McLaren Macomb. You're going to find that most of the faculty here are graduates of this program too. And I think that that's one of the highlights that is educationally beneficial to our residents. We have consistency in the education that we provide to you. There is little to no turnover of our faculty and our attendings here in the ER. This additionally helps to provide you with a community and a team. And that community and that educational team will provide you with the best support to attain the educational goals that you're looking to meet in residency. If you're looking for a residency program that is going to provide you with a variety of clinical patient pathology, a high volume of patients, lots of procedures that are hands-on for you, alongside faculty members that give you educational consistency clinically at the bedside and educationally, academically in the classroom, then I think McLaren Macomb Emergency Medicine Residency Program is the fit for you.
I think when I first rotated through here as a medical student, the program gave me a sense of camaraderie. I felt like everybody was just in it together, and the attendings really were trying their hardest to make you learn what they felt was necessary to get you through, and they wanted you to learn. They wanted to teach. They wanted you to learn as much as you could. And I felt like it was a great program to be able to provide me what I needed as a resident and then as an attending. And a lot of other programs are very competitive, and you don't get the family type atmosphere that you get from our program. And I didn't want to be in a program that I felt like I wasn't an accepted equal. So when I joined the program as a resident, I definitely got what I was looking for.
So just graduating as a recent graduate from this program from residency, the transition to being an attending and being faculty has been a little more seamless than I anticipated. And I think that has to do to the preparation of our residency program. We have a lot of responsibility as residents, overlooking junior residents, being involved with teaching, and getting that opportunity to do that as a resident really propelled me to understand that that's something that I want in my career and to be involved in medical education. So I think the opportunities I had in residency are definitely laid out my future and my career path in that way.
I felt like what drew me into being faculty here was that I wanted to continue that legacy. I wanted to continue the education that I received, and I felt like I always wanted to be involved in residency and teaching, and I felt like it gave me a good opportunity to be able to be the teacher that I wanted to be and that I was trained to be. Our residency program has always been a strong program, but to be part of that now as part of the core faculty is really what I've always wanted to be.
In my residency so far, the coolest thing I've probably done, within HIPAA, without any violations, I've had some pretty critical patients who've come in, a couple that had severe gunshot wounds that I won't give any more details on, but taking care of them and watching them recover and walk out of here later that was probably the coolest thing I've done so far in this residency.
So regarding the curriculums, the didactics, and the educational experience here, it's definitely a hands-on experience. If you're looking for a passive learning experience, this probably isn't the place for you. But if you're willing to put in the time, put in the work, see patients, be involved in education, talk in didactics, be an active learner, then this is a place that would fit you well. I can only say enough good things about our didactic program, the level of attending involvement from both the faculty perspective, but even non-faculty clinicians here. Everyone in this group, this ER group, is definitely interested and invested in resident education, and it shows in the residents that they produce.
The learning atmosphere in our ER is one of a very close, cohesive, knit group. We try to work one-on-one with residents. We try to have the residents do a lot of teaching. The senior residents teach our younger residents as well. We teach in didactics, we teach on shift, so we have a variety of teaching, and I think that gives us a very well-rounded approach to teaching and to learning. Our residents are very self-motivated, they're very independent learners as well, and they're focused. They know what they want to achieve and they know how to get there. So We just try to motivate them and keep them interested and keep them to the top of their game for the rest through the residency.
I try to get done with everything I can with my charts, with my dictations that we have to do here. After my shift, I try to finish it before I leave from here, so I'm not worried about doing anything work-related when I'm not here. Then I focus on other things, speaking to my family, going to the gym, or even hanging out with the friends here. So it keeps a balance in a sense. I'm trying to keep work at work and not take it home with me.
One of my favorite things about teaching a resident is seeing how they progress throughout their careers, because when you first start as a resident, you're very green. You have very, scared and kind of perplexed as to what the next step is, and then to see within a few short years some of the residents that come out of our program are amazing, and they're such strong doctors, and they are confident and capable, and I would trust my family members with them as their caregivers. And to see the progression of how quickly things turn for these young doctors and how much they learn in such a short period of time, it's really been an amazing thing to see over the past few years, and I'm always excited to see how all of our senior residents are such capable physicians at the end of their residency.
So I think what I like most about this residency here is the biggest thing is probably our camaraderie. I think our residents get along great, our attendings get along great. I went to some other programs that I thought wasn't a great fit for me, and when I came here, I felt that it felt like kind of home, and it was just easy to get along with everybody, easy learning environment, so I thought this was a good fit for me to land here at McLaren Macomb.
I think for incoming applicants, my biggest piece of advice is find a program that fits for you. As much as programs are interviewing you, you got to remember that you're interviewing programs just the same. So I think that the fit test is a test that maybe doesn't match on paper, but something you got to remember when you're pursuing a residency. And finding that place where it marries the type of program you're looking for, the type of educational environment you're looking for, is going to give you the best chance to be the best doc you can be.